Hey, it's Mo Egger. If you love college basketball as much as I do, then you will love long necks. The 4K TV setup is awesome, and by the way, the sound is always on for the big games. And if you tried the wings at Long Necks, you owe it to yourself. Plus, no place in Northern Kentucky has a better beer selection. There's 3 locations, Wilder, Hebron, and Richwood, each one of them very easy to get to, each one of them with a great outdoor setup for when the weather gets warmer. Long Neck Sports Grill. Stay late, come often. Every week since August, we have chatted with one of the experts from OrthoCincy. We talk injuries and obviously a pretty heavy baseball focus today. The great thing about OrthoCincy is they've got specialists, locations all across the tri-state area. They've also got walk-in orthopedic urgent care with evening and Saturday hours. Edgewood and Eastgate, 9A to 9P. And on Saturday from 9A to 1P, you can learn more at orthocincy.com. That's orthocincy.com. With us is our friend. He has been on the show a number of times, Dr. Angel Velazquez from OrthoCincy. Let's start by talking about Elly Cruz, who is going to miss some time with a left hamstring strain. Give me the range or different grades between a strain, a hamstring strain, and a hamstring tear.
Well, the hamstring injuries, I look at the hamstring injury, and we look at it to be if it's a muscle injury or a tendon injury, okay? So we look at the muscle injury and say, okay, it is a grade 1, grade 2, grade 3, and most of the time what we're looking is how many fibers are involved. If it's just a little inflammation without significant fiber disruption, it's probably a grade 1. If it's some fiber disruption of the muscles, a grade 2. If it's a complete tear, it's a grade 3. There's other places I talk to you about even a grade 4, but a lot of time is muscle injury versus tendon injury. If it's a tendon injury, you can have a partial tear, you can have a complete avulsion of the attachment or the origin of the hamstring. So that is going to tell us, how serious is the injury, and it's going to give you an idea for how long it's going to take to recover. The average for somebody who is a grade 1, grade 2, we're talking about 10 to 25 days. A grade 3 can be up to 12 weeks, and sometimes even grade 3 or complete avulsion of the tendon can require surgery. So it's depending what the injury is and where exactly it is.
Elly is only 21 years old. Is it at all concerning that we're talking about a player so young dealing with this particular issue?
No, regularly, no. Most of the professional athletes, if you look back and you look on NFL, you look on professional, baseball, they and even soccer players, they come back from these injuries, especially if it's a muscle injury. Muscle has a lot of blood flow, so there's a lot of healing properties. And even tendon injuries, there's a lot of different treatment options, that don't require surgery that can help them to come back. You look back in baseball, I remember Jose Reyes back in the Mets, that he has a lot of hamstring injury, and he had multiple times where he got a lot of time that he can in and out of the field, but at the end of the day, he got a long career, and he missed some time, but at the end of the day, he did really well. So I see this young guy that had an injury for whatever reason was, could be dehydration, could be not stretching well that day, could be for so many reasons, and and just recover really well and come back and have a good career.
Let's talk about another prospect, a guy who had a huge spring, guy that is a big part of the Reds moving forward, Encarnacion-Strand, and he played through pain. He put up good numbers, but he played through pain in his back. He is going to miss a couple of weeks at the minor league level because he's got a disc herniation in his back. What is a disc herniation?
Well, when you look at the back, you see the bone. You have, I assume it's going to be on the lumbar area. There's 5 lumbar vertebrae, and in between them, there is a sac of fluid that is called the disc. And the disc protects those bones from hitting each other and give you some cushion over there. So when there's a disc herniation, what that means is that the disc came out of the area that's supposed to be. And when they come out because you can have a little tear to the disc, or you just herniate it or pushing out of place. And it's depending what is the disc herniation touching. So those disc herniation can be touching a nerve, and that can give you symptoms down to the legs, or it can be just being out of the place and cause you some mild pain. So, looking at it, that's the definition of the herniation is a disc that comes out of the native or the place that should be.
What are the treatment options for him or for anybody who's dealing with a disc herniation?
Well, the herniation, if it's not touching a nerve, obviously it is less likely to be problematic. It can become problematic later on life, even not just when he's playing sport, after playing sport. But at the end of the day, you number one, see how bad is the disc herniation. Sometimes you can have injection, we call epidural injections, and injection the area where the herniated disc is. That decreases the inflammation, make the symptoms better, especially if there's a nerve being irritated. Sometimes just steroid pills, anti-inflammatory medication, some muscle relaxant to relax the muscle, and a core and a lower back strengthening program. That is going to be the key. The key is a maintenance program where his core and his lower back is getting to a point that he doesn't have that many episodes or doesn't have the episodes at all.
Let's talk about another guy, Luke Weaver, a free agent they picked up this offseason, a guy with experience. He's going to miss some time. He missed basically 2 weeks of spring training with left forearm soreness. It does appear that he's back on track to join the team reasonably soon. He didn't throw a ton of innings last year. He did just throw this past weekend in a minor league game, and he said he felt pretty good. But we're dealing with forearm soreness. What are some of the possible causes?
Well, forearm soreness is a generalized, way to say, a way to describe where the pain is coming from. There's different areas on the elbow that can be affected. You're talking about flexor mass, that is the muscle, the flexor wrist, that help pitchers to do rotation of the ball. You can have a flexor tendon injury that is more, like a strain or a partial tear. You can have an ulnar collateral ligament. You could have a little bit of nerve irritation. So if we take on consideration what we know about it, that is a flexor or forearm soreness, means that there's probably some tendinitis, some irritation. Probably he got an MRI that showed that there's no structural damage. And, that is a good sign. It's a good sign that he's throwing, he missed just a couple of weeks and he's now start throwing right away. That means that his pain is gone. So the pain go away. You don't let them start throwing with pain. So the pain goes away. They correct some areas that may have some weakness in the shoulder or the arm that can be predisposing him to get the pain. And he's now ready to start doing his increased loading to get to start.
Okay, one more. Dr. Angel Velazquez from OrthoCincy. This is maybe a dumb question, but baseball players have been in Arizona and Florida for the last 6-7 weeks, and certainly the last few weeks it's been warm. And in most of the country, it's not yet warm, and so there's going to be some cold weather games. So are there injury risks that come with guys who have become conditioned to playing in the warm weather when suddenly they're playing in the cold weather?
Well, definitely it's going to be an adaptation. If you look, the Reds are being in town for the last several days, so they didn't flew in yesterday or today to start playing tomorrow on a big change. So they have some days to a little bit of acclimatization. These players, most of them have gone through this, every year. I think that Arizona is a good weather for baseball players because in the morning it can be in the 50 degrees. So they can be outside, with a little bit of cold weather. But definitely going from warm weather, going all sprinting where all the blood flow is going on your body because it's warm, and now going in the colder weather, it is something that can affect. But the truth is, these guys this is their life. They are professional athletes. They prepare, and they will get warm, and they will have in the training room, they will have in the dugout some heaters, some things that can keep them, warming off. At the same time, they will use, extra layers that can keep them, warm up enough, and they will even, stretch in between innings, get into a bike. They will do things to continue getting warm up and get ready to perform in the game. So yes, there's some risk because they're going from a really warm, a lot of blood flow in your body to a little bit more cold, and you get a little bit more stiff. But at the same time, they will prepare and they will have all the tools that they need to stay warm and stay ready for playing.
Awesome insight as always. Look forward to doing it again soon. Thanks so much.
Thank you, Mo.
Much appreciated, Dr. Angel Velazquez from OrthoCincy. The folks at OrthoCincy, first of all, you never need an appointment at OrthoCincy. It's convenient. Emergencies, you can't plan on them. An orthopedic injury, urgent care injury, doesn't just happen where you can make an appointment. So at OrthoCincy, you never need an appointment. They've got convenient hours in Edgewood and Eastgate from 9 to 9, 9A to 9P, and then on Saturdays from 9A to 1P. Perfect. More convenient than an ER visit. Definitely cheaper than an ER visit. Again, orthocincy.com. That's orthocincy.com. Hey, it's Mo Egger. If you love college basketball as much as I do, then you will love long necks. The 4K TV setup is awesome, and by the way, the sound is always on for the big games. And if you tried the wings at Long Necks, you owe it to yourself. Plus, no place in Northern Kentucky has a better beer selection. There's 3 locations, Wilder, Hebron, and Ridgewood. Each one of them very easy to get to. Each one of them with a great outdoor setup for when the weather gets warmer. Long Neck Sports Grill. Stay late. Come often.